Hello, everybody, and welcome to What's Going On Seaville. I'm Lana Young.
And I'm John M.
And we have some very special guests in the house tonight that are going to set some things straight for us. We've got Kimberly Farish from the Charlottesville Health Access, and we've got board member and director or chair of fundraising, Robert
DeLanoy.
Thank you. I didn't want to get that wrong. DeLanoy. Welcome to the show, ladies.
Thank you.
Thank you so much for coming. So why don't we start with your mission for the Charlottesville Health Access? Explain to our viewers what you're all about.
Well, we help people in the community with healthcare access and prescription assistance. So we are advocates for the homeless and underserved to access healthcare.
And so sort of a voice for them.
We're a voice, but we're also on the front lines actually doing the work.
Hands-on.
We definitely connect people up with healthcare that often cannot access it themselves. And we're a very important part of the people that we serve.
That's wonderful. You know, some people might say, well, you know, they're homeless. Why can't they help themselves? Is there something you want to say to people that sort of have a misconception about homeless people?
Most definitely. A lot of people don't realize that homeless people are people. They're human beings like yourself, like myself. And they have had things happen in their lives that put them in this place. And some of us are very close to that. We don't know who, you know, either one of us could be homeless under circumstances. And a lot of them face things like mental health issues, substance abuse. It's all piled on top of them, and they're trying to live their lives, and unfortunately sometimes that leads you to a place of no home. And I think that they really do need to have a voice for that, because they are people, and a lot of people don't really look at them that way.
Yeah, that's wonderful.
How do they find you? How do you guys get in touch with each other, you and the homeless?
Well, our offices are located at the Haven at First and Market, which is the day shelter for the homeless in downtown Charlottesville. And actually, we've been doing this for about 3 years. This organization was actually started by students from UVA medical students, and they wanted to find out what it was like to have barriers in healthcare when you're homeless. So they connected with the Patcham shelter, and they started doing health fairs. And so we were just basically pretty much underground for quite some time. But we were on the front lines there in the shelter with the homeless individuals. So they have a relationship with us and they trust us. And in January, when we moved into the Haven, we are now so much more accessible, not only to the people in the Patcham shelter, but the people at the Salvation Army. And of course, we also served, which we labeled the underserved, which are people in general who, yes, and there are a lot of underserved people. In fact, there are more underserved people than there are homeless people in our community. There are people that might be on Social Security disability, maybe they get veterans benefits or whatever, and they're just not making it. And they need an advocate when it comes to their health care, or they need help affording their prescriptions.
Now, Robin, you're the chair of fundraising, and you're also a board member, but your day job is RN.
Right. I'm a nurse. Yeah, I'm a registered nurse, and that really helps out because I was in the facility and working with the homeless, and to see how things work and to be able to help them make their appointments, doing their blood pressures, doing more clinic kind of things. To help them with their glucose, and being able to talk with the physicians in the ER room if they need to go there at some point, to be able to talk their language.
That's wonderful.
And that really helps, because then they really know what's going on coming from a medical person.
Because you can put it in layman's terms for them and sort of speak with the doctors and the medical people. You're with the Fluvanna Women's Correctional Facility, is that correct? So tell us how that is a bridge.
The reentry program with the jail system, that's also a good component of what we do as well for the people that are coming from that facility, of how they community get back into working, getting back into their health, knowing that they need prescriptions. We help with all of that as well, getting them set up again to be here in the community and to be, you know, a person that's working.
When you guys say that you help, like, who are you talking to? Okay, who do you take it to?
Well, with their medical needs, we get them appointments for their. Let's say they have eye issues, ophthalmology appointments or dental appointments, or.
So there's a group of doctors that work with you.
Are some. We have some partners that help with us with. Like prescription assistants and things like that as well. So we're trying to partner with various organizations to be able to do that with them.
That's wonderful.
Our main partner is University of Virginia Medical Center. We send the majority of our people over to the UMA clinic, and we also work with the free dental clinic at the health department.
Great.
Yes.
You know, I saw in some of your literature it said that one of the main the primary problems with homelessness is diabetes and heart disease. What do you attribute those two to?
Well, they're not getting the nutrition also that to be able to help them in their medical needs with those things. I mean, there's stroke, there's an awful lot of other things. There's dermatology. I mean, what we do at Charlottesville Health Access is get them different educational programs that we send. We have specialists come in for dermatology and talk about nutrition. Nutritionalists will come in. We give different seminars to them that are from people that have like a podiatrist or whatever, and be able to give them those special things that they can come and say, okay, I have a person to contact. I have a person that knows things. They're going to come back at a certain time, and they get more trusting to know what they can expect, for their health needs, and just get information that they probably don't have. We do HIV as well.
Great.
So we cover a lot of bases.
That's wonderful, and I want to ask one more question about this, and then move on to some of your fundraising events. But by you helping find health management for them, I suppose, it takes it out of the emergency room, and that's quite taxing.
Absolutely.
So explain that a little bit, how you're actually sort of steering it away from the emergency
Well, when you're in an emergency room, and that takes a half hour or more to sit there and waiting for an appointment, when you have something that can be easily taken care of in a doctor's office, it's really helpful. You don't have to tie up the emergency room with non-emergency things. So in that aspect, it's really helping the emergency room stay clear of things that are non-emergent, that can, be otherwise.
It also actually saves us as state taxpayers money, because we have to pay for all of that through the university, all of us, because they're indigent clients and they are financially screened. Another thing that we do is really important that I really want to touch base on is we do the vaccination clinics for the shelters, and we just had ours last Wednesday. Martha Jefferson Hospital donated 50 vaccinations for us. We also worked with the health department to do TB screening, and we're really on the front lines of anything that will come up in a shelter situation. And it's very exciting. It's very exciting, and they all just really depend on us every year to do that, and it's great.
That's wonderful. I want to talk about Charlottesville's Got Talent.
We want to say the second annual Charlottesville's Got Talent. This is our second year on that.
That's fun. And when is that?
It's in March.
Yes.
Okay. Tell us about it.
Well, actually, our auditions are January 22nd, and they're going to be at the Haven. This is an incredible event. Last year was huge. We were at maximum capacity at the Haven, and Monticello Media Group this year has actually adopted us on this project. So we're going to be over at the Doubletree Hotel, and it's going to be fantastic. We're going to have celebrity judges, MCs, and the acts. The caliber of the acts here in Charlottesville is so amazing. There are extremely talented people here.
There's a lot of talent.
And last year was fantastic. I'm sure this year is going to be as great. And we really invite people to come out and audition. It's a great opportunity to really get known here in the community, and it's a big event.
Do you take actors? Shakespeare or something?
Can he juggle and dance at the same time or something?
No,
we certainly had those.
I'm sure we can
That's
find
nice.
something for you.
Well, I would love if you could tell us where our viewers could contact you or find out more information or figure out, volunteer or donate.
Yes, please.
Please share that information with us.
Well, they can obviously go to our website. You can go there to sign up to audition. You could also sign up as a volunteer because we do have a crew that we're putting together to help with this event. It's very exciting, and just know more about it. We'll keep everybody posted as time goes on.
Do you need volunteers?
Absolutely.
Always?
Yes,
Always need
definitely.
volunteers.
You know, I wanted to ask, is there any branch of the medical field that you wish you had more association with that you don't? Because I know you bring in people of various degrees of medicine. Is there any one that you wish that you had more access to?
We need more partnerships. That's correct, with physicians in the area, and more nurses that come forward. I mean, we're doing a lot with UVA Nursing School. They're doing a lot of things for us, and that's great too with the health fairs. So they're coming out to help with that. But anyone that wants to volunteer their time, we'd love to have them.
Excellent.
We actually have nurses in our facility every day that we're open. So we always have healthcare professionals there. And yeah, we definitely need some more nurses. That would be
Wonderful.
fantastic.
Yes, thank you so
Yeah,
much for doing
thank
what
you.
you do. We really, really appreciate
Facebook?
it.
You on Facebook
Yes,
yet? What is your Facebook?
Charlottesville, yeah, Charlottesville Health Access is on Facebook, and then we have our website, charlottesvillehealthaccess.org.
Yes, and you'll be able to see that magically appear at the bottom of the screen as I talk, because I've got the power.
Maybe we can get you to come back as we get closer to Charlottesville's Got
Yes.
Talent.
Oh,
That
that'd
would be terrific.
fantastic.
That would be
Maybe we'll
lovely.
cover it. Who knows? That would be nice.
great.
The opportunities are endless. But thank you so much for coming and shining a light, your light, on
Thank
the
you.
homeless, probably underserved. And God bless you.
Thank you.
Thank you.
Thank you so much.
So stay tuned. We've got some great guests coming up. Thanks for joining us.